Hey Bilal, I thought I'll make a video for RCT man. Okay, first thing is you should know about the instruments. Okay, understand the concept. Okay, let's say this is a tooth. Okay, so this is a tooth and this is the root. So RCT, the canal lies like this. So you have to understand your axis should be straight line axis. So always in the anterior, the cingulum is like this. So when you make an axis opening, you start like this. Okay, you start like this, then you shift your direction so that your axis opening becomes like this. So for that you have to first do in exam they might ask you to do a complete thing. So first of all, when you do upper, you will be like this. Okay, so you keep assume my pen is your hand piece, so it goes like this and then you turn like this. Okay, so you got the straight line axis now. Okay, be very careful. So you make a straight line axis. So now there are two ways people do things. Okay, either they enlarge the cervical area and then go here, or some people they do this and go back, but I would advise go to the cervical area. Okay, whenever after you do, there will be a sufficient opening here. Okay, why we have to do the cervical orifice? See, cervical orifice, when you widen, it becomes like a funnel. Okay, so your instrumentation will not have any bend, so it will go straight. So when you make this area slightly wider, okay, so it is easy. Theoretically what we do is different from what we do in our practice. Okay, in our practice we use rotary files, but in exam, since we are going to use only hand files, what they are doing is they use something called Gates Glidden. Okay, Gates Glidden burr. Okay, so it is nothing but a TC pear shaped burr. It's a long burr with some markings. So if it is 3, there will be 2, there will be 1. Okay, so this is Gates Glidden 3. 4 lines means Gates Glidden 4. So I will teach you what Dr. Matty taught me. So first of all, when you use 4, okay, just do one thing, put the instrument and wherever it stops, okay, just mark this part. Suppose you are put one stopper, put any this file ka stopper hai na, usko laga ke just, or you can mark it with pencil or whatever, just put the stopper and whenever it stops passively, okay, say for example imagine this is my line and this is the where it stops, go 2 mm. So 2 mm means you would have widened like this. So imagine here you have used 4 size Gates Glidden because it's very wide here. So the next is 3 is slightly wider, so you don't have to enlarge so big. So what you have to do is you are incrementally, so this is size 4 will go only up to 2 mm, then this 2 mm you use size 2. What you have to do is, it's very easy. You go back, you go and touch, wherever you touch, go 2 mm. Okay, with that first, so use 4 size and go 2 mm. Then you use the third, go passively and touch, wherever it touch, just 2 mm. So this canal will become something like this. So 4 size, then 3 size, then you go for 2 size. So like that 4 3 2 ek bar kar le na, your canal will become something nicely like this. So now this part is over, so cervical part is done. Okay, so now you will have freely you can do. Okay, now what you have to do, you have to do the apical preparation. So always when you zoom the apical area, your apical area is like this. So we have something called major foramen, minor foramen, and all that. So generally you are in the X-ray, whatever you see in the radiographic tip, we always think if root is like this, the tip will be like this. Tip will not be here. Tip could be here. Tip could be here. Even tip could be here. So what they do is generally they reduce 0.5 mm from the tip, from the radiographic apex. Okay, so that is where the anatomical apex. Anatomic means actually where it is. Radiographic means somewhere in the X-ray tip. So what we are doing here, so how to do it clinically here is, first what you have to do, first you have to put the 10 size file or 15 size file. Okay, so generally in your exam they might give the total length of the tooth. If they give total length, see there are two things they might give. Total length is say 22 mm, so you reduce 0.5 mm, which means 21.5 will be your working length, or sometimes they will give the working length directly. Okay, if they give working length directly, don't do anything, just take the file, take 15 size file okay, set to 21.5. If they've given tooth length, you minus 0.5, okay, and estimate the working length. Okay, this 0.5 is because you are assuming your radiographic apex, total tooth length minus 0.5 is always, generally people do 0.5, even up to 0.75, 1 mm they do. So I recommend 0.5 in Manikin teeth. So 21.5. See, you have to think two things. One is the length of the file, other one is the circumference of the file. So length of the file is, they might give a 21 mm length file with a 15 size. 15 means the diameter of the tip, okay. 21 is the length. Length means this height. Diameter of the tip. Suppose this pen is 21 mm length and the tip is 15, means this is 15 and this is 21 mm. So what you have to do, go till the working length 21.5, and what you have to do is you just file it. So always you should know, whenever you file it, you have to do something called watch winding motion. This is watch winding. Okay, how you correct your watch? See, this is my watch. So in my watch I used to do this. Okay, I used to do this. I don't do up and down motion. I used to do this in canal also. You do watch winding. You do watch winding, you pull. Watch winding, you pull. So slowly you will reach. So first is you put the thinnest file, 15 mm file, go till the length, okay, and you have to, first thing you have to do is widen the apex. So your natural orifice is this. When you use 15 mm, your file will become like this. Then you use 20 mm, your file will become like this. Then you use 25 mm, your file will go like this. So in a Manikin teeth, you use 15, 20, 25, even you can go up to 30 or at least to 25. 25 should be the first binding file, which means that is the file which will bind here. 15 will be smaller here, 20 will be like this, 25 will be engaging the whole thing. So first binding file, because once it binds only this area is getting prepared. If it is loose, this area debris will be still there. So the concept is the first binding file. So once you use the first binding file, imagine this is your root and your file is sticking here. Okay, now see, imagine this orifice is taken care. This orifice is here. Okay, it is enlarged. Now you don't have to bother about the orifice of enlargement. So you have to use the next thing is called step back. So step back is, so imagine 25 size file. This is 25 size file. Then you reduce 0.5 mm. Says this is say 21.5. See, they have given the working length. Till the working length, you have used size 15, 20, 25. Okay, so 21.5 ho gaya yahan. Then now you have to take care of this part. So you reduce 0.5 in the 20 see 25 tak aap 21 see 20. This is see 15, 20, 25 size file you have used up to 21.5. Now keep it to 21. And use 35, then keep it to 20.5, then use it to 35, then keep it to 20, okay, then make it to 40. So likewise, when you reduce, your canal will be like this. Initially it was small, now it is become like this. So incrementally, already you have done gates cleared on this side. So this side is taken care of these files, and this side is taken care of these files. So that is the logic. Now what you have to do, you have to use a master cone and take an x-ray. In exam mostly it is just up to master cone. So what you have to do is put a master cone and just put a master cone here, okay, and then put accessory cones. That master cone should be whatever size you have used in the apex. Say if you have enlarged up to 25, so that will be your master cone. So put, because that only will exactly fit here. Okay, don't use bigger size. Bigger size is for cleaning. Always one more thing is, when you use 15 and 20, go back to 15 and recapitulate. It is like when you use a bigger file, more debris will collect. So you have to use a smaller file to make it flow. So irrigate nicely and remove the debris, and make sure you don't clog it. Okay, if you clog the later part, your this thing will not go. Your file may stay stop. Exam, they will see whether you have gone beyond apex or properly. This is accepted. If it is very short, then you have to be very careful. That is what they will see. In an RCS LDS exam, they will tell you to put just one GB point. That's it. Okay, so this is the concept. So the first thing I revise, good access opening, then you have to shapen the cervical part using Gates Glidden. Then you have to find out the working length. The working length, they might give a total length means minus 0.5. This is the working length, or they will give the working length directly. So take the working length and start preparing with the first file 15, 15, 20, 25. Go up to the working length. Then you have done the apex. Then check the binding file. The binding file will be 25. 25 should snugly fit. If it is loose, go to 30. Okay, and keep it 21.5. Then you reduce. Okay, so reduce in reduction you have to use 21, 20.5, like that. Keep reducing 0.5, 0.5, 0.5. See, when you reduce the length, this is length and this is the width. Okay, width of the file. So file size 30, file size 35, file size 40. Then you take the master code and take an X-ray. Finished. This is not a complicated thing at all. This is very simple. All the best.